Welcome to a Driving Healthcare Effectiveness and Efficiency episode of the Fed to Fed podcast by GovTech Connects. This special series, brought to you in collaboration with Maximus, focuses on best practices for meeting evolving health needs and improving citizen experience by combining advanced technology and human-centered design principles. We'll explore how emerging technologies can drive transformation in a way that effectively and efficiently delivers health services, programs, and systems with flexibility, security, scale, and human connection.
In this episode, we take a deep dive into the future of military healthcare, exploring how digital innovation is essential to advancing readiness by building systems that are more resilient, agile, and centered around the patient. Drawing from decades of experience and fresh offsites shared at the Defense Health Information Technology Symposium, DHITS, themed Empowering Care, Enhancing Readiness, Harnessing Health IT Innovation, we examine how breakthroughs in data, artificial intelligence, interoperability, and digital infrastructure are revolutionizing care delivery across the military health ecosystem. Featuring diverse voices and perspectives, this episode highlights how emerging technologies are reshaping both the patient experience and mission readiness to deliver a future for military health that is digital, personalized, secure, and remains mission ready, especially with constrained budgets and personnel shortages. Welcome, Dr. Jennifer Garrison and Mr. Alex Dixon. Well, thank you both so much for joining us today. Dr. Garrison, Alex, we're thrilled to hear more about diving into the future of military healthcare and exploring how digital innovation is essential to advancing readiness by building systems that are more resilient, agile, and centered around the patient. So, Dr. Garrison, let's go ahead and start with you. How are digital innovations helping to create military health information systems that are more resilient and agile in supporting mission readiness?
So, Susan, that's a really great question. As a prior operational medicine director at DHA, I can tell you that that topic is extremely important. So, the integration of digital health truly offers opportunities to increase our operational readiness, improves our clinical outcomes, it enhances our quality and safety, it reduces risks, and of course, fortifies that resiliency that the total force and all of Department of War beneficiaries are looking forward to. So transforming the DHA into a digital health force multiplier is really not an option, but it's just really necessary to ensure mission success across the Department of War. We understand that failing to embrace digital transformation will hinder DHA's ability to effectively support the national defense strategy as we know it, deliver the joint capabilities that our warfighters are looking forward to, that are needed specifically by our armed services and our combatant commands that provide that quality care to the total force and the Department of War beneficiaries. We understand that at DHITS this year, it was definitely eye-opening for us because that roadmap for our government contractors are preparing to support that DHA mission. So I would say the key takeaways that Maximus are one, in no particular order, was the Reverse Industry Day. It really highlighted for us the direct opportunities to bring forward those solutions that can shape the DHA's acquisition strategy. We understand that it addresses the capability requirements for system performance to evolve during the life cycle, because as you know, as evolving technology, threat, or interoperability needs are to reduce the program cost or schedule and enable that technology refresh. Operational medicine modernization via JOMIS. I work with JOMIS directly for a couple of years to create that demand that we need for an inoperable, secure, and deployable IT infrastructure, modernizing those solutions and prioritizing those to make sure that we have the data backbone that our line combatant commanders need, and also to provide that critical data transport and that management capabilities that are key to the JOMIS operational medicine modernization activities. I would be remiss if we didn't talk about the Joint Federal Electronic Health Record, because as you know, that rollout means years of integration, customization, and cybersecurity work ahead, and working with us at Team Maximus, playing that vital role in ensuring that seamless adoption. We understand that working with multiple efforts, that will be the Department of War, the Department of Veteran Affairs, Department of Homeland Securities, the U.S. Coast Guard, the Commercial National Oceanic and Atmospheric Administration. Those are just a few to name that we can help support this level of effort.
That's fantastic. Thank you so much, Dr. Garrison. So, Alex, how are emerging technologies balancing the need for personalized care with the imperative of maintaining security and privacy in military health?
I think that is one of the biggest questions that we have right now, right? I think moving toward the personalized care approach, whether you call it precision medicine, whatever you decide to call it, right? That necessitates data interoperability, data sharing, the coordination across IT systems. Well, that opens a slew of other issues with that security of that data, the privacy of that data. You need to ensure patient trust in your system, that that patient data is not leaking, whether it's inadvertent by accident or whether it is some sort of cybersecurity threat, attack, or other data breach. So, I mean, we really need to ensure that we're not just talking about data in an electronic health record cloud. Maybe that's protected by the cloud defenses. We have a lot of data in transit. So we need to make sure those APIs are secure, that any type of data in transit is secure. We're talking encryption for sure. I mean, at Maximus, we're already, again, looking at the post-quantum cryptography, right? As computers advance, as we move to a quantum computing world, the better capabilities, maybe of adversaries, maybe of cybersecurity bad actors, right? We need to make sure that data is protected not only in an electronic health record cloud, but also as it moves along. I think key elements when it comes to the military health system, it's not just a standard healthcare system. The data that is within there has operational impact, right? Any breach or leak of military healthcare data could impact an operation. It could be used by our adversaries to know and geolocate where our forces are. It is an extremely important element, and the military health system is taking this as a paramount concern. Regardless of the emerging technology, what benefit does it offer? Can it help personalize medicine? Can it get to a precision medicine space? That's the reward, but they have to look at the risk, and they have a robust risk management framework that they are not just going to accept or take that reward, that capability on face value. They have to run through their processes. And some contractors, some companies, oh, this takes too long. It takes forever to get an authorization to operate within the DHA or MHS network. That's for a reason, right? They are weighing the risks. It's not a no. It's not an outright no until they've gone through their risk management framework and they've understood, okay, what is the risk to the network if we introduce this new emerging technology? So at DHITS, we actually heard a lot from the DHA IT leadership, the CISO, the CIO, talking about the zero trust journey, where they are. I think that the DHA, the MHS on a whole, is very advanced on their zero trust journey because they designed and engineered their MedCoin network. They did it with HIPAA in mind and protecting that health information already. So before zero trust was really a buzzword, they were already thinking about engineering to protect that data in certain manners and separating a little bit from the standard DoD DODA network, the NIPRNet, and having their own protected network to help secure that data. It's a journey. Zero trust is a journey. DHA is well on their way to the FY27. I think they're going for the zero trust target level by the end of FY27. I think they're getting there, right? They are definitely knocking out the actions that need to be done to protect the network, to also move again from that perimeter-based defense to an identity-based defense. So I think they've made great strides. Emerging technologies are always looking to balance and strike that balance between the capability and the security. And I think DHA has done an outstanding job of analyzing that and making sure they're not introducing risk to their network.
I love that perspective, Alex, and your work, and Dr. Garrison, your work for years aligned with the warfighter, aligned with operational medicine, aligned with the J6 and the importance of all of that. As experts looking ahead, what are the biggest opportunities and challenges a mission ready, digitally enabled military healthcare system faces?
I'll jump in on that, and Dr. Garrison, please chime in as you feel appropriate, right? I'm just going to say, I mean, regardless of the military healthcare system, right, there are specific needs and opportunities and challenges on that phase. All healthcare systems within the United States are seeking to strike that balance. How do we leverage this new technology to enhance care, to frankly enhance the health of our beneficiaries, all while providing that privacy and security of that data and also enabling autonomy for that patient to have control of their healthcare journey through the system and through multiple systems, right? I mean, when you start out, your first job, whether you're enlisted in the military health care system or enlisted in the military, or whether you're working for a private company, right? That's not always going to be your healthcare plan or your healthcare provider through retirement, through senior citizen age, right? So maintaining that ability to interoperate that data across the span is a key challenge for all healthcare systems. So, I mean, when it comes to the MHS, I do see numerous opportunities in the future, but I'm really going to focus on a few. Frankly, we heard at DHITS. I mean, the first is leveraging artificial intelligence capability to help enhance delivery. So we heard a lot about Ask Sage at DHITS. This is one of the first forays for the DHA and the MHS into the artificial intelligence space, and they are analyzing Ask Sage. Ask Sage is a large language model capability. Uniquely, it kind of pulls in different models that already exist, and they're trying to authenticate and authorize the utilization of Ask Sage on their network. If that AI is authenticated, authorized, and has access to PHI, the protected health information, then you unlock doors to precision medicine, personalized medicine, efficiencies on your administration and clinical teams, eventually maybe getting to that point where the provider can utilize that tool to really drive into precision medicine for that patient. Right? That's an interesting opportunity that they are, again, mid-flight in getting that and analyzing how that can be utilized on their system. Another thing we heard at DHITS, and it's been something that might be near and dear to Dr. Garrison's heart, is a unified readiness system. So we have our different services within the military. They do have some unique readiness health elements. Certainly, somebody who's in the submarine is going to be somebody different who then flies an F-16 or F-35, right? However, there's a lot in common with our military to make sure they are ready, health ready, to be deployed, to be out there. So we need to work, and DHA and the MHS need to work toward what can we have as a common level for a unified system so we don't have these legacy systems still hanging out there that are accumulating technical debt, and again, get the efficiency. So there's not somebody in the Army, Air Force, and Navy having to worry about this system, that it can be controlled at an enterprise level by the DHA within the MHS with the customization for each service as needed. I think that's on the horizon. And finally, I'd be remiss in not mentioning a true longitudinal electronic health record, right? That goes from enlistment to deployment in theater to garrison at home to retirement or transition to veteran status to Medicare eligible. Data that follows that individual, that patient through their entire experience. We're getting closer. We've been talking about the electronic health record modernization and everything within the PEO DIMS on that side with MHS Genesis. They are working, and the JOMIS team, Dr. Garrison mentioned, they are working toward that theater electronic health record, electronic medical record, that healthcare data from the field, and making sure that follows the patient the entire way. That's an absolute opportunity that they have to kind of seize on. They are moving in that direction. It takes time. It takes resources. It's not an easy fix. We've been talking about this for quite some time, but it's something that I think they have an opportunity to really seize on and moving toward. The challenges that they face are not unlike any other healthcare system, in my opinion, but I don't see them necessarily as technological challenges. And it might sound cliche, but I see them as resource challenges. Do they have enough money to do what they need to do? Do they have enough people to do what they need to do? There have been constrained or stagnant budgets from the health IT perspective for multiple years. That's impacted what they've been able to do to kind of erase some of that technical debt, implement new technologies, innovate. I think there's always a challenge on that front. Do you always have enough resources to do what you want to do? No. But how do you select what you want to do given your constrained budgets? And the DHA IT leadership specifically has all the steps and processes in place, but they have to be highly selective and prioritize where they're going to put their money. So things like Ask Sage, the AI tools, they're going to ideally have a large reward, large return on investment at the end of the day. They're going to put their money there, right? Some other ideas, some other tools, maybe they don't make the cut. So they're going to have to be highly selective. I also have to mention the people, DHA, MHS, they have outstanding people. FY25 has been a very interesting year across the entire federal government landscape. And unfortunately, the DHA and the IT team, they've lost quite a lot of great leaders over this year, whether to deferred retirement or resignation program or VERA, whatever it might be. It can take decades to build up a level of knowledge and experience and leadership experience that the DHA has lost. They have great people waiting in the wings. They've got great people stepping into those roles, but it's going to take time for them to really develop their leadership skills and mastery of everything that's going on within the DHA IT ecosystem. And I think that's one of the goals that they have, right? They need to identify and get those personnel as quickly as possible. The resource issue, the financial issue does play a factor in that. Hiring new personnel to join the team. If you have constrained resources, again, you got to be highly selective and move forward as quickly as possible on that front. So I think those are the key challenges. Again, they're not technological by nature, it's more managerial. But I'd love, Dr. Garrison, if you have thoughts on opportunities or challenges.
Yeah, Alex, I think you're spot on because when I was a part of operational medicine as the director there at DHA, we had the Operational Medicine Information Technology Steering Committee to do exactly what you talked about. We had summits bringing all the service together collaboratively to talk about what does good look like, how are we going to modernize that digital space, making sure from a role 1 all the way to a role 4, how do we bring that patient back in safely, and having that critical information at the fingertips at that provider's hand so they could make those critical decisions, because we all know in flight your priority could change. So what is it that we need to have to make sure that I understand there's connectivity issues, there's latency issues, but with the technology that we have using AI and predictive analytics and the great team that we have at DHA working with the services, we can collaborate with our government contractors and say, how can we best move this forward? I know we have the power to do so. It's just making sure we all prioritize because we can't boil the ocean overnight. So do that timeline, march that out, working together to make sure we can execute the mission appropriately.
Dr. Garrison and Alex, is there anything else that you would like to share?
If you're okay, Alex, I thought the DHITS this year was really eye-opening, like Alex talked about, because if you look at the theme, it's called Empowering Care, Enhancing Readiness, Harnessing Health IT Innovation. This goes back to your question, is operational medicine and IT together? Yes, because the DHA made it very clear at this DHITS that the DHA is both massive in scale, it's ambitious, and it's innovative. So for government contractors like Alex and I, this is a call to action, bringing in the smart people. What are some opportunities that will flow for those who can bring in those solutions that scale, integrate seamlessly, and will direct improve those mission outcomes? I will say the MHS, the Military Health System, and DHA have been working on an AI mission and vision strategy that they have constantly finding ways to incorporate AI, machine learning into specific areas of the military health, keeping in mind that it must be done in a reasonable, ethical, and trustworthy way. That goes back to what Alex was saying. And for those reasons, MHS and DHA have taken their time to analyze these AI tools to launch on their network. So like at DHITS, like Alex just said, we're launching Ask Sage, a large language model AI that's uniquely close to, and it offers multimodal capabilities. The DHA's goal is to enable this and make sure we implement using Microsoft Copilot, a generative AI assistant within its Med 365 application platform to empower efficiency and effectiveness on daily tasks. And that's awesome because Copilot is being tested before implementation across the enterprise. So when they roll it out, it's done correctly. Health Affairs is working to identify those actions that is needed to enable that advances in adoption of artificial intelligence and machine learning across those military medicine, and ensuring those robust safeguards. That's critical to make sure that they are in place. And I would be remiss if I didn't say that the Office of the Assistant Secretary for Health Affairs has identified those 5 key areas for promoting trustworthy AI and machine learning. And we understand, and when we develop our capabilities, it's making sure we maintain an AI and machine learning inventory, and that guidance that's responsible for that AI, provide guidance for a trustworthy generative AI, promote and enable a digital workforce, because we know that's critical. And we also promote and coordinate with our other DoD and federal agencies, so we're in lockstep with them. So as we execute the mission, it's enabling the warfighter to do what they need to do.
Awesome. Alex, last word.
Just to piggyback on what Dr. Garrison said and kind of bring another item to the table. When we talk about AI, it's only as good as the data. And we heard a lot at DHITS, and we've heard in multiple conferences in the military health system, the move toward data literacy across the agency, the move toward understanding where all the data is, what applications are in existence today. And the new CDAO at DHA is driving forward with initiatives to understand the data landscape and implement an integrated data ecosystem. So yeah, the AI tools are outstanding. Does it connect to the right data sets? Do we have the right source data? Is that data clean? Does that data need to be in a common data model, right? Like, are we using the same terminology? So we heard that at DHITS quite a bit. It is a key push. Everything that we already talked about with the privacy and security of that data is paramount. And the DHA IT teams will handle those pieces. But I think we'd be remiss on the DHIT space not mentioning the data modernization journey that they are on. However, starting with the understanding of what data is out there, like what do we have? What do we already have in place for data analytics? What applications are there? And making sure that they are driving lockstep with what is going to impact the services, what is going to help with the readiness mission, what helps with the readiness of our clinical teams and healthcare providers, and get there. I think they're getting after it. And I think DHITS really hit that home that they are implementing, even with those constrained budgets I talked about, they're implementing smart, innovative moves to get to the goal that they want to reach.
That's wonderful. It's certainly an exciting time over DHA and MHS to protect our warfighters and to provide them the best care that's available. Thank you both so much for joining us. That was such an incredible discussion. I look forward to additional conversations in the future.
Thank you so much, Susan.
Thank you, Susan.
Thank you for joining us today. To find out more about digital innovation for federal health optimization and resilience, visit the Driving Healthcare Effectiveness and Efficiency landing page on govtechconnects.com. Don't forget to subscribe to our podcast channel to stay up to date on the latest episodes.